The classification of angina severity. The classification of angina severity according to Canadian or American, according to the Canadian or American. Yes, this is Canadian actually. This is the Canadian associations. This is the Canadian Cardiovascular Society. This is the Canadian Cardiovascular Society. So Canadian Cardiovascular Society, they describe the angina or the angina class into 4 types. The class 1, that for example, that is the type 1. That is the type 1 or the class 1. In the type 1, they tell that like, and they classified based on the symptoms, like based on symptoms. So what are the symptoms we see? If we see any ordinary activity that does not cause angina, like if we see the angina or the chest pain with strenuous exercise, or like if you having patient is doing some physical exercise, so at that times we will be having angina, and we classify that into the type 1 angina. So what you will see, there is a ordinary activity, there will be the ordinary activity will be there. And this ordinary activity, remember, ordinary activity, or we can say some physical exercise, ordinary activity or some physical exercise will be there. So that will be type 1. In type 2, remember, there will be the, like if there is a slight limitation of the ordinary activity. If we see the slight limitation, if we see there is a slight limitation, if slight limitation is there, it means that this patient will be having the type 2. This patient will be having the class 2 or the type 2 angina, type 2 angina. Or we can say that if the slight limitation of ordinary activity, there will be the type 2. Like if the patient is walking, now after the walking, after some time the patient has got the pain or the angina or the chest pain. So at that time we will say this is the which classifications, that is the type 2. The type 1, that the ordinary activity or physical exercise. This ordinary activity does not cause any angina. So if any angina with any sternus, or we have some rapid or the prolonged exertions, that means that is the class 1 or the type 1. Then type 2 will be having, the patient is having the slight limitation of ordinary activity, or there is a, we can say that angina will be developed with angina only during vigorous physical activity, only during the vigorous physical activity. So that is the type 2. Then type 3, remember that in the case of the type 3, we will see that these patients will be having, there is a marked limitation. The patient will be having the marked limitation. Marked limitation, like if example, if this patient has been like type 2, according to the Croak, remember they will give you the distance also. For type 2, remember, more than 500 meter, he can walk more than 500 meter, and after that the chest pain has been started. In type 3, remember, there will be the mark limitation, means less than 500 meter, there will be the less than 500 meter will be there. So marked limitation will be there of ordinary physical activity, marked limitation of ordinary physical activity. Like if this person has been walking, or this person has been going up to the stairs, so after 500 meter, less than 500 meter, like you can say 200 or 300 meters, he got started the chest pain. So that is the type 3. After the type 3, there will be the type 4. After the type 3, there will be the type 4 will be there. So this patient, type 4 patient, then type 4, remember, the type 4 will be having, this patient will be having the inability, to carry out any physical activity, So these patients we call it as the type 4 class, if type 4 angina, or the type 4 angina, or type or class 4 angina. So this patient will be having carry out any physical activity, and we can say there is angina at rest. We can say the angina at rest. Okay, like see, this question is saying complaint of pain with relation to the left scapula. The pain appeared during the significant physical work, and that is last for 5 to 10 minutes. 5 to 10 minutes and is over on the rest. The pain appeared during significant physical work. There is a no distance has been mentioned. So this is the first established angina pectoris. This is the first established angina pectoris. That is the actually ischemic heart disease, first established angina pectoris, because there is no distance has been mentioned. If they will mention the distance 200 to 300, type 3. If it is more than 500, then it is the type 2. Okay, so all three questions are in your workbook. After that, okay, understand this. This is the classification based on the Canadian Cardiovascular Society. So that you need to remember, and this is the classification of angina severity according to the CCS, according to the CCS, Canadian Cardiovascular Society. Then after that, question number 61. Question number 61 is saying that medical examination of 19-year-old worker revealed generalized lymphadenopathy mainly affecting the posterior cervical axillary. So whatever the questions about, so this patient will, you can see there is a cervical axillary and ulnar lymph nodes are involved. Multiple injection mark on the elbow band skin. The man denies taking the drugs. The presence of injection mark ascribed to the influenza treatment. Blood RBC is there, hemoglobin is there, WBC is given, moderate lymphopenia. So this patient is lymphopenia. So this patient can having the we can suspect the leukemia. We can suspect the leukemia because influenza can also cause like some type of the lymphatic disorders. So that's why to confirm the leukemia, we will do the lymph node biopsy. Biopsy, always remember, to rule out any cancers, we do the biopsy. So for that we will do the lymph node biopsy, because we have seen there is a lymphadenopathy, and all due to all these things, what we will do, lymph node biopsy will be done. Okay, till now. After that, question number 62. 62 is saying if 24-year-old patient felt sick in 16 hours after dried fish intake. After the dried fish intake, there was a nausea, vomiting, weakness, flabbiness, double vision, diplopia. हमने पढ़ा था ना diplopia. Diplopia is a feature of botulism. And dried fish intake or the canned foods means that is the Clostridium botulism. Okay, there is a decrease in the muscle tone. Why there is a decrease in the muscle tone? Botulism, they release the endotoxins, and this and botulism, what they will do? They inhibit the synapse. They inhibit the synaptic neurotransmitter. Due to which we will see there will be the decrease of muscle tone will be there. After that, we will see there is gentamicins, and gentamicins, or what they call, they are the nephrotoxic drug. They are the nephrotoxic drug. Gentamicin is what? That is the nephrotoxic drug. Okay, so remember these things. First, in this question, remember, I hope everyone, because this is the important question and you will get all the three type of the questions. If you see the first time recurrence and this pain has been over on the rest, means this is the first time occurrence and first stabilized angina pectoris. The function class 2, if you will say that the chest pain after walking 700 meter to or 800 meter means more than 500 meter, that is the type 2. If the pain or mark limitations, that it means type 3. If it is less than 500 meter, here you will get 150 or 200 meters, and in this condition we will see there is a vasospastic. There will be the vasospastic will be there. And this attack of the chest pain will be relieved with the help of calcium channel blocker, nifedipines, all these we can give, because there is a due to some vasospasm will be there, and that's why we will see that the mark limitations will be there. In why it is differentiate from the unstable angina. In unstable angina, the pain will not be relieved by any nifedipine, nitroglycerins, or all these things will be not relieve the pain in unstable angina. So they all, we can say, there is also the type of the variant angina. They are also the type of the variant angina. In variant angina we see this type of the classification. Okay, this is the important one. You can having some today from pronunciations can be different from my mouth because I have some ulcers has been in oral ulcers, so that's why it can little pronunciation difficulty can be there. Okay, then next question, a 40-year patient was admitted to the gastroenterological with the skin itching, jaundice, discomfort in the right subcostal area, generalized weakness. On examination, we see the skin is jaundice, trace of the scratches, liver is plus 5 centimeters, spleen is 6. So here you can see the splenomegaly and hepatomegaly is there, alkaline phosphatase is there, ALP is there, general bilirubin is also increased, cholesterol is also increased. So what we will see in this such conditions, always remember, if such type of the condition is there, we have the cholestatics, and cholestatic means accumulation of the bile. This type of the condition occur in the accumulation of the bile, and due to accumulation of the bile, we will see the patient will be having the skin itchings, there will be the jaundice because of the accumulation of the bile, and discomfort in the right subcostal area. Okay, then you understand these things, and in the question they can give you the symptoms of the small intestine related also, because and in the small intestine like the steatorrhea problems can be there, because this bile will come into the small intestine, so there will be the problem in the digestions of some food particles because of limitation of the bile, because bile has been accumulated somewhere on, and now we are not able to get the bile in the small intestines, due to which we will see that small intestine symptoms can also be there. After that, the question number 65, the ECG we discussed yesterday. So remember, there is one more thing about the pulmonary embolisms. So whenever the pulmonary embolism question has been comes and they give the some history, pulmonary embolism, you know that there will be some embolus formations will be there, but remember the ECG finding. Remember the ECG findings. In ECG findings of the pulmonary embolisms, you will see the three conditions. There will be the Q3 S1 and you can say S1 Q3 or T3. S1 Q3 or T3 will be there. S1 Q3 T3 will be there, and there is an increase in heart rate. There will be the increase in the heart rate. What the mean? That in lead 1 you will see the S waves. In the lead 1 you will see the S wave will be seen. In lead 3 you will see there is a Q wave will be seen. In lead 3 you will see T waves or inverted T waves. There will be the inverted T waves will be there. Okay, so if you see in the lead 1 we see the S wave, Q waves or inverted T waves. Here you can see the ECG shows the Q3S1, the Q3S1. It means in lead 3 we have the Q waves, and in the lead 1 we have the S waves. Along with that you see the heart rate has been increased. So what will be there? That is the pulmonary embolisms. And also you know what the acute lower extremity thrombophlebitis. If you don't know about the ECG findings, still you can mark this answer, because in the thrombophlebitis there is a thrombus formations that can be like movement and can form the embolus. Okay, embolus is you can say the like movable thrombus. You can say that is the embolus. Movable thrombus is what? Embolus. On the 7-day treatment, he suddenly developed pain because of the embolus has been stuck down, and body temperatures increases ho gaya. Patient was also found to diminished breath sound without wheezings. PS is there, and AP will be there. After that, question number 66. A 51-year-old female is waving for a tree. देखो एक था वो that person is working under the some vibration, machinery factories or weaving factories there. So it means there is some machinery, machine part or machine workers, the person who is under working under the machines or working with the machines. They 15 years of the service record. During a regular preventive examination, she complained of frequent headache, poor sleep, tingling in the heart, irritability, rapid fatigability, hearing impairment. For now you see the hearing impairment will be there, for the noise level has exceeded the maximum allowed concentration by 10 to 15. So it has been increased, like it will be 120 decibels or it can be 140 decibels. That is very dangerous to our ear. A year ago, the patient underwent course of treatment for essential hypertension. Specify the most likely diagnosis. So one question was about the vibration disease. If the person is working under the some a machine with the machines, so with the machines they will be having some vibrations type of the things that will lead to the vibrations. And if you have the person is working in such industry in which there is a more noise pollution will be there, so the due to that more noise pollution you will be see hearing impairment will be there, and due to of course there will be the headache, the poor sleep will be there, and tingling in the heart. This is because of the increase in the sympathetic system will be there. So we call this as a noise disease. Okay, and in the question they will give you like something related to hearing impairment, or there is a like maximum allowed concentrations, there is increase in the noise levels, so that will be mentioned. If 26-year-old patient on the course of the treatment, अभी देखो इस क्वेश्चन का मेरे को भी नहीं पता क्या सीन है, but we can remember these questions, mug up this question. If the chronic glomerulonephritis will comes, then we will do the what we will recommend, the south coast of the Crimea. If anyone knows about this, let me know. If you studied anywhere or something. Okay, so what sanatorium and the health resort treatment could be recommended? So if the chronic glomerulonephritis, if in the question they can change like the some chronic conditions can be changed. So if the some chronic conditions can be given in the questions, then remember what treatment or what sanatoriums you will recommend, that is the south coast of the Crimea. Okay, this is the Ukrainian waste, like maybe they mentioned if the person having some chronic conditions or such type of the conditions, and after the treatment they should send the person to the Crimea. But now that is the not the Crimea is also the not the part of the Ukraine, so that's why this question will not come. Okay, or maybe this question have some problem. So, but by the way, this question will not come because Crimea, it's not the part of the Ukraine. Sorry. Now you see the wasp bite. So wasp bite, what it will cause? Urticaria or the type 1 hypersensitivity. So the type 1 hypersensitivity, what drugs we will use? We will use the steroidal drugs, prednisolone or dexamethasones can be given. Steroidal drugs will be given. And there is edema of the lungs, eyelid or the cyanosis. So that's why this is also act as the anti-inflammatory drugs. So a 16-year-old adolescent was vaccinated with the DTP. So if the patient has vaccinated with the DTP, diphtheria, tetanus, pertussis, so in that condition what we will see, that there is a tetanus toxoid will be there. There is the tetanus toxoid. So remember, tetanus toxoids, it will cause the type 3 hypersensitivity. It will cause the type 3 hypersensitivity. The stiffness or pain in the joints, yes, we will see there is a glomerulonephritis or SLE, we see there is a pain in the joints, that is like immune complex has been deposited in the joints. Subfebrile temperature, urticarial skin eruption is there because it is, don't confuse with the urticarial skin eruption. But because along with that you will get there is a pain in the joint, stiffness is also there. Where we studied pain in the joint, stiffness, this is occur when there is a deposition of some immune complex. So that's why we will see there is a stiffness and the pain in the joints. After that, this question we have done, this face edemata is there. Okay, edema is there. the gradual progress, edema of the lower extremity, pale skin, worsening of heart sounds, hypertension is there, relative density, protein is 5 gram per liter, that is the nephrotic, and erythrocyte is given. I told you if the erythrocytes or all these things is given in the field of the visions, what we will see, that is the acute glomerulonephritis. In pyelonephritis we see the WBC cast in urine. After that, see this question. Now you are seeing the patient while walking handed for 150 meter. You are seeing the retrosternal pain several times a day while walking for the 100 to 150 meter. The pain lasts for up to 10 minutes and can be relieved by the nitroglycerins. The pain lasts for 10 minutes and it can be relieved by the nitroglycerin. If it is relieved by the nitroglycerin, definitely it is not the unstable angina. It is the variant angina. Okay, the patient is overweight, heart border exhibit no abnormality, heart sounds are rhythmic, pulse rate is there, and ECG contains low amplitude of the T waves in V4, V5, what disease might be suspected. So what we will do, we do the stable FC, 3 stenocardia, functional class 3. Okay, this question that we discussed before. After that, you see there is patient will be having the peptic ulcer disease, and the peptic ulcer disease, what we study, there are two conditions. There will be the gastric ulcers and remember, and there is a duodenal ulcers. Which is the most common? Duodenal ulcer is the most common. Duodenal ulcer is the most common. And remember the peptic ulcer disease. Remember the peptic ulcer disease. In peptic ulcer disease, if we talk, this is most common cause of upper GI bleeding. This is the most common cause of upper GI bleeding. This is the most common cause of upper GI bleedings. In the gastric ulcers, the pain will be relieved by vomiting. The pain relieved by vomiting. Here in this duodenal ulcer, what you will see, the pain will be relieved by food or the meal. Pain will be relieved by the food or meal. I teach you this. I taught you in the, I think before, right? पढ़ा दिया ना ये? Discussed it, yes. Yes, answer is the ELISA for HIV. We have discussed in the previous class the ELISA for HIV. That's why I didn't discuss. So there is a pain relieved by the food or the meals, that is the duodenal ulcer. The gastric ulcer, the pain will be relieved by the vomiting. And also remember, in gastric ulcers, what you will see, when the pain will be there, pain will occur immediately after the meal. Pain will occur immediately after the meal. ले लो रखा. And here you see the pain will occur after, the pain will occur after 2 to 3 hours. The pain will occur after 2 to 3 hours. So that is duodenal ulcers. Okay, what the investigations we will do? Investigations we will do in this condition. So remember, the investigations we do is the upper GI endoscopy. And the treatment, I told you that lifestyle modification first of all, and after that, if the lifestyle modification is not done, then we can go for the PPI, that is the proton pump inhibitor. Then if the proton pump inhibitor is not suitable to the patients and patient is not giving any response, then we can go for the eradication therapy. Eradication therapy, we discussed the triple therapy and all those things. Okay, so there we will see the in developed stomach ache arising 1.5 to 2 hours after having meals. There will be the 1.5 to 2 hours after having meals and at night. He complained of the pyrosis and the constipation. The pain is getting worse. The pain is getting worse after consuming the spicy, salty and sour food. They all are the causes of the peptic ulcer disease. Whether it is the spicy, the salty or the sour foods. It relieved by means of the soda and hot water bags. The patient has been suffering from this disease for a year. The first moist tongue, abdomen palpation revealed epigastric pain. The epigastric pain, it is seen in both gastric ulcer as well as in the duodenal ulcer. The resistance of abdominal muscles in the same region. The resistance of the abdominal muscle in the same region. What is the most? Because there can be the resistance due to this person will not able to, the person don't want to move because of the pain. What is the most likely diagnosis? So most likely diagnosis will be the duodenal ulcers, because here is a 1.5 to 2 hours after the having the meals. Okay, if it is immediately after the meals, that is the gastric ulcers or the stomach ulcer. Chronic pancreatitis we have discussed already. Cholecystitis is also. There is a dull pain. There is complaint of the dull pain in the right subcostal area. So dull pain in the right subcostal area. What we have in the right subcostal area? We having the spleen or liver. We having the spleen or liver in the right subcostal area. Nausea, vomiting, decline during 6 months. Then there is a history of gastric peptic ulcer. This in the question we will be having the gastric peptic ulcer is there. So in the right subcostal, what we will be having? So we will be having the liver. We will be having the liver. So if the liver is there, okay, and but read the questions and epigastric area. The history of the gastric peptic ulcer. On examination, the pulse is 70, AP is 120. Diffuse tender resistance of muscles on palpation. There is a hard lymphatic node. There is a hard lymphatic node in size over the left clavicles. What method of investigation will be most useful? We know that for the gastric peptic ulcer or any peptic ulcer disease, what we will do? We do the upper GI endoscopy, esophagogastroduodenoscopy. What we will do? Esophagogastroduodenoscopy or upper GI endoscopy. But here you see the hard lymphatic node. So rule out the cancer. We have to do the biopsy also. Biopsy is done to rule out the cancer. Okay, then for investigations for peptic ulcer, that is the upper GI endoscopy, or we can say esophagogastroduodenoscopy. Okay, so understand this. After that, question number next on the 29th of the June. Now, if you see, there is a June month. In the June month, we will be having summer. So there will be some infections or mosquitoes can be things. A townsman was brought to the clinic. The disease broke out acutely. So what we have seen, the townsmen are brought to the clinic. The disease broke out acutely, starting with the fever, rise in the temperatures to 38 to 13. There is also was weakness, acute headache, nausea, vomiting, pain all over the body, sleep disorder. On physical examination, you see there is a hyperemia of the skin of the face, neck, thorax. Meningeal signs are positive. 12 days ago, the patient returned from the Siberia. So if you see any patients coming from the Siberia, if this Siberia, remember, then in the Siberia, this understand that there is one disorder we call the Lyme disease. The Lyme disease, it is caused by the Borrelia burgdorferi. Borrelia Lyme disease or the Borrelia burgdorferi. Burgdorferi. So this is the common in the Siberia peoples, and it is caused by the ixod stick bite. This is caused by the ixod stick bite. Okay, and also remember this block the AV, means AV block, it causes the AV blocks. Atrioventricular block will also be done. And for the treatment, what we can do? We can go for the tetracyclines, and we can go for the ceftriaxones. Okay, so remember that is the tick-borne encephalitis, Cypheria. And there is a meningeal sign positive, that's why we will be having encephalitis. Encephalitis we can having the meningeal sign positives. And they cause the encephalitis type of the things. Now next question, we have the same right epigastric area after having fatty food. So fatty foods, any biliary pathology, what we will do? We have discussed the choledocholithiasis, acute cholecystitis, cholangitis. So first investigation was always, what was that? Ultrasonography. After that, the next questions, a complaint of the tiredness, sweating, enlargement of the cervical, submaxillary and axillary lymph node, blood test is showing. So now there is a Botkin and the Gumfred's body. What is the answer? Chronic lymphocytic leukemia. Okay, that is the chronic lympholeucosis. किसी को कुछ ना समझ में आए तो बता देना, because we have done after 12 Indian time. A 38-year-old patient underwent observation having polyneuritic sore with considerable loss of weight, fever, rise in the BP, blood test, considerable inflammatory changes. What examination is the most expedient to make the diagnosis? See if any polyneuritic syndrome, then there is a considerable loss of weight. There will be the loss of weight. The loss of weight or the weight loss, what is that means? That means that is the this is the sign of the cancer. This is the sign of cancer. Polyneuritic syndromes. Polyneuritic means the nerves are affected. The many nerves are affected. If the many nerves are affected and there is a rise in the BP, blood test consider inflammatory also. So what we will do to rule out, because there is a loss of weight is there and there is a nerves are affected. So these patients we can having the suspicion of the cancer. So for that what we will do, we do the muscular biopsy with the, we will do the biopsy to rule out the cancer. We do the biopsy to rule out the to rule out the cancer. After that, HLA-B27 antigen, that is the ankylosing spondylitis. A patient is complaining of periodical headache, dizziness and the ear noise. She has been suffering from diabetes mellitus for 15 years. Now she has been suffering from the diabetes mellitus for the 15 years. ठीक है भाई. There is a diastolic shock about the aorta. In urine we see density 1.015. Daily loss of the protein with the urine is 1.5 grams. So this question is this one. What drug should be chosen for the treatment of arterial hypertension? So what drugs will be given in the arterial hypertension? So that is the ACE drugs. The ACE drugs will be given. So why the ACE drugs? ACE drugs are the PACE. Remember the PACE. PACE. So PACE. PACE. P for pills. P for pills will be there. If the diabetic patient in the question, if the diabetic patient is given in the questions, and in that patient we will see there is a, like the, you can say the blood pressure is there 110, and along with that you see the daily loss of the protein with the urine is also there. So these considerations with the help of the kidney involvement, and that's why we will be having the angiotensin converting enzymes will be given. Okay, remember the all other are all the alpha blockers, then thiazide diuretics, they also the, like they're also the hypertensive drugs, but here you are preferring because the patient is having the diabetic mellitus conditions, and along with that you see there is a proteinuria, and so in that patients we will give the ACE inhibitors or the pills, captopril, lisinopril, all these drugs will be given. Okay. Now the patient is having the hypothyroidism. What you will do? Determine further treatment. Deck 6. He is taking the thyroxine. He is taking the thyrodoxis twice a day. After that, he is developed the tachycardia, sweating, irritability, sleep disturbance. So this patient will be having the high dose of the thyroxine. That's why we will decrease the thyroxine dose. Then this patient has been discharged from the hospital after having an out of hospital pneumonia. Out of hospital means that is the community acquired pneumonia. That is the community acquired pneumonia. Pneumonia we discussed in pediatrics class. During auscultation, there is a harsh respiration to the right of the lower part of the lungs. X-ray shows the infiltrative changes are absent. Intensification of the pulmonary puncture to the right in the lower lung. How long should the doctor keep the patient under the observation? So remember the value. Here the direct questions that you need to remember the value. And for if the community acquired patient pneumonia is there and the patient will be having like 78. So for the observation, the key patient under the observation. So remember that will be the 12 months for observations. Okay, just this is the value fact that can't be described, so remember the value, that is the 12 months. Okay, nothing logic here. A 20-year-old adolescent lives in the needles of the tuberculosis infection. The tuberculin Mantoux test with the 2TU tuberculosis unit was determined as hypergenic. What sign determined the hypergenic test of this adolescence? Now see, when we do the tuberculosis, so in tuberculosis we do the tuberculin test. Which test we will do? Tuberculin test will be done. In tuberculin test we will be having the papules formations. When we do the intradermal injections, so at that time we will be having the papules formations will be theirs. एक second रुको. Hello. Okay, let's come. What is the meaning of diastolic shock over the diastolic shock over the aorta? इसका मतलब है कि they are talking about the diastolic shock index. तो diastolic shock index होता है कि like heart rate divided by the diastolic arterial pressure. ठीक है, so based on that, so that's why the diastolic shock index means. I'm writing it here. यहाँ पे था some good questions. So remember the diastolic shock index. Like for the diastolic shock, they measure the index, and this index is measured with the help of heart rate divided by the diastolic arterial pressures. So based on that, so we measure the how much shocks will be there, diastolic shocks will be there. Okay, then we have the question number 82. So 82 was saying that in the TB what we will do, the tuberculin test will be done, and tuberculin test what we will see, these papule formations will be there, and when these papule formations will be there, we call this as the positive tuberculin test. And positive, and here you will see the like the papilla, in the mm's you will see that around the 6 mm papilla will be formed, and it will be the like if I think this is the note will be asked, but if you see the papule formation, if you see the papule formations, it means if the papule formation is there, it means that there will be the patient have some immunity. The patient have some immunity. The patient have some immunity is there, and this patient will not have the tuberculosis. If that means the tuberculin test is positive. That means tuberculin test is positive. It means the tuberculin test is positive. The tuberculin test is positive. No, sorry, the tuberculin test is negative. Means tuberculosis will be no tuberculin test will be negative in this condition too. Because if the papillary formation is there, means patient have some immunity, and tuberculin test will be negative, means the patient has not infected, no previous exposure will be there, and the patient will be having like very good immunity, and the patient will be like the tuberculin test will be negative. Okay, and remember this value also, that if it is the 6 mm papilla will be there, and the patients will be having the some necrosis type of the things can be there. After that, the pneumoconiosis, we have discussed that there is a 15% of the free silica is there, and we will see the patient under minor. So minor we have the black or the anthrax, and we will be having the anthracosilicosis. See, you can do the silly mistakes. If you studied the minor only, if you study the minor, so in that things you can think that is the anthracosis. That is the anthracosis, and they give the question also about the anthracosis. They will, in this question they didn't give the options, like they can give you the anthracosis also, the anthracosis, and that was the option number A, and you will mark that. And after that you will see, alright, there was a free silica also, so that why their answer will be the both will be there. So remember, if the carbon is there plus silica will be there, so that means what we call with anthracosilicosis, or we can say the coal miners. Coal miner will be there. Coal miners, anthracosis, everything we have discussed. So this is the anthracosilicosis. Then question number 84. A patient's complaint of the pathological lump appearing in the right inguinal region. So what you have seen, there is a right inguinal regions on the exercise. Lump is round shape, 4 cm in the diameter. On palpation, soft elastic consistency, position near the medial part of the Puppett's ligament. The lump is situated inward from the spermatic cord. What is the most probable preliminary diagnosis? If it is the medial side of the Puppett ligaments, so that is the right-sided inguinal hernia will be there. So see, we have discussed about little bit about the hernia, umbilical hernia and all those things. Now let's discuss the hernia, like they are from the scrotum regions or the inguinal regions. So the most common is what, that in the groin or the scrotum regions, that is the indirect inguinal hernia. The most common is the indirect inguinal hernia. If talk about the most common in young males, so that will be the indirect inguinal hernia. If we talk about the elderly males, remember, there will be the direct inguinal hernia. Okay, then remember that if you see in females, we will be having the femoral hernia. In females we will be having the femoral hernia will be there. In females we will be having the femoral hernia, and that is more common, 4 times more common in females than the male. Okay, the most common to undergo the strangulation. So that is again femoral hernia. Okay, so these all are the very important one-liners. The most common in the young males, elderly males, femoral hernia, and most common undergo the strangulation. So that is a femoral hernia. Okay. What is the difference between the indirect and the direct inguinal hernia? The hernia, if we say that it can be the indirect or direct. Hernia, we will be having the first one, indirect and direct. The indirect inguinal hernia, they are very common. First of all, like we have discussed here, there is the indirect inguinal hernia, the most common and the most common in the young males. Other than that, remember, if they protrude directly from the deep inguinal rings, they have seen the deep inguinal rings protrusions. If they protrude from the deep inguinal rings, so that means that is the indirect inguinal hernia will be there. Okay. They are present inferiorly. They are present laterally. They are present laterally with inferior epigastric vessels. They are present laterally with the inferior epigastric vessels. They are the direct questions you will get in the questions, in your Croak 2 questions. Direct hint you will get, and after that you will be able to solve the questions. So the deep inguinal ring protrusions, then indirect, present laterally with inferior epigastric vessels. Or you can ask in the question, they can give you the relation with the inferior epigastric vessels. So remember, the indirect inguinal hernia, it present laterally to the inferior epigastric vessels. Direct inguinal hernia, remember, they are the common in the elderly, and they protrude through the transverse fascia. And the transverse fascia, we will be having the triangles, that is known as the Hasselbalch triangles. There will be the Hasselbalch triangles, and that's why we called it the direct inguinal hernia will be there. Along we will be having the border here, because it is a triangle. So this triangle will be having, on the medial side we have the rectocetes, on inferior we will be having the inguinal ligament, and superior laterally we will be having the inferior epigastric vessels will be there. Okay, what is the relations relation of the direct inguinal hernia with inferior epigastric vessels? So it presents medially to inferior epigastric vessels. It is present medially to the inferior epigastric vessels. Okay. Like this type of the things will be there in the questions. Like this here we will be having. So if you see that here we will be having inguinal rings. So this is the like scrotal area or groin area, and here we will be having, that is the deep inguinal rings. That is the deep inguinal ring will be there. The deep inguinal ring will be there, and within the deep inguinal rings where we will be having the vessels, or I will make it by red. So this is the inferior epigastric vessels, you can see. Then after that we will see that there we will be having one triangle will be there, that is the Hasselbalch triangles will be there. That is the Hasselbalch triangles, and here we will be having another, that is the opening, that is the superficial, that is known as the superficial inguinal rings. That is the superficial inguinal ring. Okay. So if you see that if it is protruding through the here, so it means that is direct inguinal hernia. If it is protruding through the here, that it means that is the indirect inguinal hernia. Okay, is that clear? Is that clear? Okay, after that you see that also they can, in the question they can ask you about the pubic tubercle also. So if you see that here you having like below the here in this question we will be having here. So here you will see there is a one tubercle will be there. Here you will see the one tubercle will be there, and we call this as the pubic tubercles. We can call it as the pubic tubercle will be there. So there is a one more phenomena, that is the inguinal hernia and the femoral hernia. The inguinal hernia, remember that I told, that is originated from the superficial, that can be the indirect or the superficial inguinal ring. So if it is there, so remember there can be a difference, like there is a inguinal hernia versus femoral hernia So inguinal hernia, remember it will be present above and medial to pubic tubercles. It is present above and medial to the pubic tubercles. And femoral hernia, remember it will be present below and lateral to pubic tubercles, so that will be the femoral hernia. So remember, this is the inguinal hernia, and this inguinal hernia, and this is the femoral hernia. So remember, that will be the fabulous. Okay, so femoral hernia below and lateral, femoral hernia below and lateral to the pubic tubercle, So that is what? Below and lateral to the pubic tubercles. होना है भी यहाँ पे, ठीक है. So we will be having inguinal above and medial to the pubic tubercles, and femoral hernia will be below and lateral to the pubic tubercles. So we call this as the fabulous. So FBL, fabulous. Okay, is that clear? Everything done? So puberal hernia we can see below and lateral. Where we will see? Around here. Here you will see that is the femoral hernia will be here. Below and lateral. This is the femoral hernia. And here you will see this is the inguinal hernia. Here you will see like below, above and medial to the pubic tubercle, you will see the inguinal hernia. How you will differentiate, what are the landmarks to differentiate the indirect from the direct inguinal hernia? So that is the epigastric vessels. So this one, inferior epigastric vessels. So this is the landmarks to differentiate to the indirect from the direct inguinal hernia. To differentiate the inguinal hernia to the femoral hernia, what is the landmark? So that is the pubic tubercles. Okay, is that clear? Everything is done? Because from here the question will be asked, like what I told you, directly questions will be asked. Okay. So femoral hernia, that is seen in female. Inguinal hernia, that is seen most commonly in the males. And femoral hernia, it is more common, 4 times more common in female than the men. And remember the fabulous, below and lateral to the pubic tubercles, and inguinal hernia, it is above and medial to the pubic tubercles. If you want to, that inguinal hernia is IM. Okay, IM. So I means inguinal hernia, A for above and M for medial. A for above and M for medial to the pubic hernia. Okay. That you need to remember. And also remember, one more thing, that cuff reflex will be present in inguinal hernia. So the cuff reflex absent in femoral hernia and present in inguinal hernia. So remember this line also. The inguinal hernia we will be having the cuff reflex, while the other we will don't have these things. Okay. The indirect hernia, that is the lateral to the epigastric vessels. Direct hernia, remember that will the medial to the epigastric vessels. And for direct hernia, medial to epigastric vessels, you can remember the DM. The DM DM. I am the DM. So I am DM. I am who I am? I am DM. I am DM. I am DM means that is the district magistrate. I am your district magistrate. ठीक है? थोड़ा respect से. हाँ. So I means that is the inguinal hernia. A means above and medial to the pubic tubercles. D4 we will have the direct inguinal hernia, and M4 we have the medially to the inferior epigastric vessels. So that you need to remember. Ho ho. Okay, 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 okay. Okay, there is a one more classifications like the Nifus classification or European hernia classifications, but I think they will not be asked, and directly they will ask you these things only. If the news classification is asked, though means that the type 1 is the indirect, type 2 will be the indirect, and the type 1 will be the small, type 2 will be the large. After that there is a direct will be included, third A will be the direct, third B will be direct plus indirect, include the direct plus indirect, and the C means who is C? Who is C? C is femoral hernia. C is femoral. Third C is femoral hernia, and fourth one if the recurrent hernia will be there, so that we call the recurrent hernia. Now you can see the medial parts of the Popper's ligament. The Popper's ligament, Poput, so it becomes the Popper lal. The medial parts of the Popper's ligament. Popper's ligament means inguinal ligament. This is situated inward from the spermatic cord. So what is the most? They have the right-sided direct inguinal hernia will be there. Okay, the medial, or we have the inferior epigastric vessels or the inguinal ligament, DM, direct magistrate. Then we can see the HbA1c is there more than 6%, so that means that is the diabetic mellitus. Then the HbA1c also 3.3 to 5.5, it should be there. If more than that, their patient will be having the diabetic mellitus. Then if women complain of weakness, painful itching after washing, bathing, sensation of heaviness. So what we have seen that on examination there is seen hyperemia of the skin of the face, neck, extremity we have seen, and spleen is 4 cm below the rib arc HH. So what we have seen in this condition, so this is what? Erythemia. What is the erythemia? Can anyone tell me what is the erythemia? Erythemia. तो बता सकता है what is the erythemia? Increase of which? Erythrocyte. Abnormal RBC. बिल्कुल सही. ठीक है, RBC. Erythemia means RBC will be there. So if there will be the increase in RBC, can you tell me erythrocytes increase in which conditions? Erythrocytes increase in which conditions? One conditions we discussed. Which condition we discussed? Erythrocytes. Ho 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 ho. There is increase in the erythrocytes number. We have discussed these things. Or another name is erythroid neoplasia, anemia. No, there is the anemia. There is the decrease. Na in erythrocyte there is the increase. So that is seen in polycythemic vera. So that is the erythroid neoplasia. Okay, so what we have discussed, there is a hyperemia of the skins, and along with that we see there is increase in the blood flow and increase in the RBC. So all the clinical features has been given other than increase in RBC, erythrocytes. The most probable diagnosis will be the erythemia. Then we see that the patient has brought to the registration unit. General condition of patient is very serious. So poor, the skin is grey, moist, turgor is decreased, pulse is rapid, intense, muscle tonus is decreased, hyperreflexia. So what you have seen, the muscle tone is decreased. The muscle tone is increased, hyperreflex is the area, ammonia outer in the area. What is the purgatives diagnosis? So if you see there is a ammonia odor in the air, so means that is the which coma will be there. See, this question has been asked in the FMG also, and we have discussed in our class. देखो from brain and from the muscles. This is the Croc one question by the way. The brain or the muscles. From the brain we have the ammonia. From the brain we have the ammonia, and this ammonia will come to which, where it will come? Into the liver. Into the liver, and this ammonia will also into the liver, and from the liver it will convert into the urea. It will become the urea, and then it will go to the urea cycle in the kidney. Urea cycles, and then it will be released out into the urine. So the question has been comes from the brains. Ammonia has been transported by which amino acid? So can you tell me which amino acids? Can you tell me which amino acid from the muscles and which amino acid from the brain? So this was your FMG question, recent FMG question. Polycythemia is correct one. Ammonia is transported by which amino acid from brain to liver? Kalagi. Kalagi. Tell the options. All the amino acids. All amino acids. Iron will transport the ammonia. यार किसी को नहीं पता. Glutamate. Is that correct, everyone? Is that correct, everyone? Everybody, is that correct? Hello, can you hear me? Alanine from brain or muscle? Croc one का कुछ तो याद होगा ना, क्या पढ़ा था क्या नहीं पढ़ा था. This is the easy questions. No one will teach you in the FMG, no one will teach you in the other exam also. कोई भी नहीं पढ़ाएगा तुम्हें आगे जाने के बाद, कोई नहीं पढ़ाएगा ये चीज. एलानिन, ग्लूटामेट, फलाना नेम का कुछ नहीं. वो आगे की बात चलेंगी, पीछे पीछे की बोलते रहना. In the end you will say Croc 1 and Croc 2 help us in the FMG exam. Whatever you have studied in the 6 years, coaching center make you fool. 80%. क्या कर लोगे बताओ. इसलिए कह रहा हूँ पढ़ लो भाई. Whatever you have studied in 6 years, definitely that will work. They will make you revisable. But if the exam will be according to that coaching center or according to that, that will be the good. But if the exams like this paper, because this paper was based on all 6 year strategy, whatever you have studied in 6 years. So जब भी कह रहा हूँ थोड़ा पढ़ लो अच्छे से. So remember the BG Ma. In Punjabi we see the Ma, but Ma means mother. Ma means mother, and Punjabi हम बोलते हैं BG और BG, ठीक है. So BG बोलते हैं पंजाबी के अंदर मदर को, तो उसको बोलता है B for brain and B for liver. B for brain and G for glutamate. So remember, and M for muscles and A for alanine. The alanine, what they transport the ammonia from the muscles to the liver, and they transport the ammonia. The glutamate transport the ammonia from brain to the livers, and then liver will urea cycles, and that will convert into the ammonia will be converted into the urea. If any problem in the liver, there will be the brain. It will be accumulated in the brain, and it will cause the encephalopathy. The ammonia will cause the encephalopathy. Now see this question. This patient will be having the resuscitation unit. The general condition patient is very serious. So pore skin is grey, turgor is decreased, pulse is rapid, blood pressure, muscle tone is increased, and hyperreflexia. There is a ammonia odor in the air. What ammonia odor in the air? So what is the presumptive diagnosis? So if ammonia odor in the urines, what we will see? This is the patients with the uremic coma. Okay. So remember these things, very important things. If from the brain to the liver, because ammonia is very harmful for our body, and that's why we have to transport that ammonia into the urea, so that urea will be like excreted through the kidney. And the biochemistry is very important here. From the brain it will come to the liver, and then it will convert into the kidney. It will go to the kidney. So the Cori cycles, urea cycles, everything is important. Okay. So what you have the uremic coma, or that will the NH2CO NH2. Okay. So in the presence of the urea will also convert into the ammonia. Urea is also converted into the ammonia. So if the uremic coma will be there, with the help of the urease, it will be converted into the ammonia part. So that's why the diagnosis will becomes that is the uremic coma. And in uremic coma we will see the ammonia will be released with the help of the urease, and that will lead to the ammonia odor in the air. Okay, this is the ammonia odor in the air. So if the air there is the uremic coma, means urea will be released, and after that the urea will be having some bacterial activities or some enzymatic activities, and due to which the ammonia will be released, and this ammonia will be released in the urine and will give the ammonia odor. Echocardiography. Distended abdomen, rumbling, increased venous evacuation, liquid formificus with the source when following the dairy product consumptions. So what you have seen, following the dairy product consumptions, there is a liquid formificus with a sour smell. So if the patient is having any dietary foods or any food, and after that we have seen that there is a liquid formificus has been done, what is the correct name of the dish? That is the dyspepsia. There is a problem in the indigestion. He is not able to digest the dairy products, so that is the indigestion problem will be there. So this is the syndrome of the fermentative dyspepsia. This question we have done, that is the alpha 2 and gamma globulins, the increase in the secondary renal amyloidosis, rheumatology we discussed. Then after that we will be having locally the increase of the diphtheria during the last 3 years with a separate outburst in the family. What measures can effectively influence the epidemic process of the diphtheria and reduce the morbidity rate to the single cases? मैंने किसी को ये बोला था कि रूमेटिक जो हमने रूमेटोलॉजी के अंदर पढ़ा था, तो उसके नोट्स किसी को बोला था मैंने सेंड करने को. मैंने किसको बोला था वो मुझे याद नहीं है, बट मैंने बोला था किसी ने किसी को कि रूमेटिक हार्ट डिजीज, इन्फेक्टिव एंडोकार्डाइटिस, इसके नोट्स मेरे को सेंड कर देना या ग्रुप में सेंड कर देना. It means you are not making the notes, या कुछ प्रॉब्लम है कि तुम्हें सुनने में कोई तुम्हारे कान में प्रॉब्लम आ रही हो, क्या पता कुछ ना कुछ तो है प्रॉब्लम, है ना, कोई ना कोई तो है. In the inhabited locality, there is increase of the diphtheria during the last 3 years. So the separate outburst in what measure can effectively influence the epidemic process of diphtheria and reduce the morbidity rate to single cases. So for that, what we have to do? So what measures we will do? If you see that the patient has the increase of diphtheria, there is 3 years with a separate outburst in the families also. So what measures can effectively influence the epidemic process? Let's see, early diagnostics, no. If you diagnose the patients early, would you able to treat would you able to prevent the diarrhea, or would you able to reduce the morbidity? No, you have just diagnosed. For that you have to do some prophylaxis, you have to do some prevention, hospitalization of the patients. The hospitalization of patient will be done, but if the condition is COVID, like for example we understand with this question with the COVID. In the COVID, if we do the early diagnostics, yes, that can prevent these patients, but in the diphtheria, that early diagnostic is not possible. If the COVID, if you hospitalize the patient, if the hospitalization of the patient has been done, so if you don't diagnose the conditions, or maybe if you're not able to, like, without immunizations and patient having the low immune suppressives, so we will be having the lower beds. So there is a decrease in the bed or the decrease in the supply of the medicine also. That's why the hospitalization of patients is not a good measures. Then detection of the carriers. You detect the carrier, but still you have the patients of the diphtheria. So how you will prevent the diphtheria condition in the patient? The disinfections in the disease focus. If you have the disinfections, you can prevent the new things, new other bacterials. Then what you need to do, that you have to prevent the immunization of the population. The COVID also, what we have done, the immunity, if the immunity will be done, vitamin C, we have to, everyone have consumed the vitamin C to increase the immunization, to increase the immunity, because the if immunity will be increased, this will be, there is a decrease in the, that with the help of that we can reduce the morbidity rate. Okay, that's why we have to do the immunization of the population. If now a patient is there, 14-year-old is there, and he is drawn out of the water in the winter after 15 minutes of the being in the water. So 15 minutes of being in the what measures, what the first measures you will do? A, B, C, D, E. A, B, C, D. Here you will do airway breathing circulations to release the respiratory tract from the water, create the drain positions. वो देखते ना in films or in the movies, what you do, पानी को बाहर निकालते हो, take the water, every water out from the body. So that will, the tactics will be applied here. To first the things we have to restore the airways, restore the respiration, then breathing, and then we will do the circulations. An electro gas welding operators working in machine workshop perform the welding and the cutting of the metals, which is accompanied by intense ultraviolet radiations. Each welding station is equipped with the effective mechanical ventilations. What occupational disease is most likely to develop in electro gas welding operators? So what we will be having, that is the, see, if you see any conditions, like I think there was a question also about, similar question was there, in which we see there is an inflammation of the eye. So what we have, if you see there is ultraviolet radiation, you see the ultraviolet radiation is going there, the machine, some metal work is there, and due to which we have seen there is a ultraviolet radiation is there, and his welding station is equipped with the effective mechanical ventilation. What occupational disease is most likely to develop in the electro gas welding operators? So what we will do, you will having the photoelectric ophthalmia, and ophthalmia is what, that is the inflammation of eye. The inflammation of eye, especially it is in the cornea or conjunctiva. It will be the cornea or conjunctiva. And remember, if we see any on a question, they will give you the history of ultraviolet light or light of ultraviolet light or light of short wavelength, or the light of short wavelength will be there. Okay, the inflammation of the eyes, history of ultraviolet light, and the light of the short wavelength will be there, will be in the question. A woman complained high temperature 38 degrees Celsius, mild pain in the throat during the 3 days. On examination, the angle lymphatic node of the jaw 3 cm large, palatine tonsil large and coated with the grey plaques. So we have discussed these things. So that will be the larynx diphtheria. Now you the pangenome fort. If what are the pancreas? Pancreas. Can it anyone tell me which enzyme will be released by the pancreas that help in the digestion of the carbohydrate, that help in the digestion of the proteins, that help in the digestion of the fat? Which enzymes are released by the pancreas? Which enzymes will be there? Fat lipase, amylase, lipase, protease. थोड़ा सा गलती होगी मनी धीरज। अमाइलेज लाइपेज, अमाइलेज तो होगी ना, हाँ सॉरी, हाँ थोड़ी सी गलती है गलती थोड़ी। प्रोटीज ट्रिप्सिन, हाँ यही गलती है, हमजा इज राइट, दैट इज द प्रोटीज, मींस प्रोटीज नहीं होता ट्रिप्सिन होता है उसके जगह पे ना। द फर्स्ट हु आंसर्ड, सो सोई संधू वाज करेक्ट। अमाइलेज, इलास्टेज नहीं होता इसमें, इलास्टेज नहीं होता उसकी जगह लाइपेज होता है। देन अमाइलेज लाइपेज, यस करेक्ट, फैट लाइपेज, अमाइलेज लाइपेज ट्रिप्सिन एंड नॉट प्रोटीज, ठीक है। सो दिस इज द अमाइलेज लाइपेज, this is the pancreatic amylase, remember, because we are having the salivary amylase also. Then we will be having the trypsin, then we will be having the trypsins, and the proteins will be having, and the fat will be having the lipase, and the fat will be having the lipase. Okay, so remember that for these conditions, like if you read the questions, if you in the question you see there is constant pain in the upper abdomen, there is a constant pain in the upper, mostly on the left, there is getting worse after taking the meals, diarrhea, weight, the patient alcohol abusers, I told the pancreatitis conditions. So in pancreatitis also we see the most common cause. The 2 years ago he had acute pancreatitis, okay, the question they have given. Blood amylase is given, program shows steatorrhea, cretoria, this is due to fat. The blood glucose is given, but treatment is indicated in this patient. So what we will give here, the patient will having the pancreatic insufficiency, this patient will be having the pancreatic insufficiency will be there. ठीक है, and that's why we will give the Panginomfort, and the Panginomfort it is used for the it's also used for the in case of the cystic fibrosis also, and this is the enzymatic preparation of the pancreas. Enzymatic preparation of the pancreas. Okay, so that's the Panginomfort. After that the next questions, मेरे को कुछ ना कुछ यहाँ से गड़बड़ लग रही है इसमें, कुछ ना कुछ नहीं सही है। ट्रिप्सिन में कुछ, आई थिंक आई कंफ्यूज, इट्स प्रोटेज ओनली, है ना, इट्स प्रोटेज ओनली एक्चुअली, नहीं सही है, इट्स ट्रिप्सिन एंड द प्रोटेज आल्सो, द बोथ आर द करेक्ट वन, ठीक है, प्रोटेज इज आल्सो करेक्ट, ठीक है, बिकॉज ट्रिप्सिन इट इज secreted by the trypsinogens, and trypsinogens it will having some intestinal enzyme, that is the enterokinase, that is present in the duodenums, that will activate the tryptokinase, and tryptokinase it further will activate the trypsins, and that will help in that protein digestions. Okay, ठीक है, चलो. Then we have the admitted to the hospitals for the acute transmural infarction. The transmural infarction is there, matlab that is the STMI or the non-STMI. If the transmural infarction is there, is it STMI or non-STMI? Transmural infarction, is it STMI or non-STMI? Is it STEMI? And if it is the conditions like no one answers, if it is the subendocardial, so that will be the non-STMI. So the transmural infarctions, what we have the MI. In MI we have discussed that there is a MONA will be there, and the MONA we discussed the morphine. If the morphine will not be there, so what we can do, we can go for the promidol. Promidol, this is also the like good opioid drugs, and the tramadol, Okay, so that's why we will be having here the promidor in place of the morphine. After that, this patient will having the intensive hospitalized in the intensive care unit, continuous attack of the retrosternal pain that cannot be relieved by the nitroglycerin, and we see the heart rate is there, breathing rate, heart sounds are muffled, gallop rhythm is present. Can you say where we see the gallop rhythm? Gallop, gallop, gallop. Oh, suna de yaar tu. How would you explain the epidope? Gallop rhythm, it is seen in, किसी ने क्या आंसर नहीं किया, ठीक है. Gallop rhythm, remember this is seen in case of the peoples like the like heart failure conditions or having the pulmonary edema. So this is seen in heart failure or pulmonary edema. So in both conditions, what you will do what you will see in pulmonary edema also there is a left ventricle failure, due to which the patients will having the accumulation of the blood in the left atria, and there is accumulation of the blood in the pulmonary veins that will lead to the pulmonary edema, and there will be the heart failure will be there. So how we would explain the epidope? So there will be the reduction in the cardiac output. Question number 98, we see the somatization depressions. So if you see any conditions, where you will don't know any like cause is given, no any etiology is given, but all the organs are involved. Like if you see the female is there, and this common seen in female only. Heart pain is there, aching and drilling, occurring mainly in the morning, in the autumn, and spring, and it is neck, back, and abdomen. Rapid heartbeat, low vitality. Occurrence of this condition is not associated with the physical activity. Occurrence of this condition is not associated with the physical activity. In the evening, the patient condition improves. Study of the somatic and neurological status, and ECG reveals no pathology. अरे भैया जी ये क्या हुआ? दादारी. तो क्या होगा? ECG reveals no pathology. What pathology most likely to cause this pathology? This is the dramatic female. Who is having the heart pain. Morning में जब इसको काम करना था, he is 35 years. She is a house lady. She is a house woman. She wanted to do work. And if it is a worker, she wanted to go home, to go to the job, but she having some spring that is heart pain is there. I have the severe heart pain in my kidney, and she is saying that is radiating to the neck, back, and the abdomen, and this condition is not associated with any physical activity. कोई physical घर पे पड़े क्या हो रहा है, दर्द हो रहा है, heart pain हो रहा है, kidney में pain हो रहा है, ठीक है. तो वो सब conditions, all these condition, what we call this condition, that is the somatic depression, somatization depression. Okay, and we call this as the somatoform autonomic dysfunctions. Somatoform autonomic dysfunctions. There is in this condition we see there is no cause will be mentioned, no pathology or no cause will be mentioned, and the symptoms, no pathology or cause. In symptoms, if we talk, that the symptoms will be looks like some serious disorder is there, and any particular disorder, it is matched with particular disorder. But when we do some ECG report, when we are doing some checkup, when we are checking the sign of the disorder, there is no sign, no pathology findings, nothing is mentioned. So that is the somatization depression. So in this condition, first we need to rule out if any organic pathology is present. If seriously is there is pathology is present, no directly ये नहीं कह देना is 35 year, अरे तो you are the dramatic female ना, that is you don't want to go to job, you don't want to do the household works, you don't want to go do some work, you want to just relax, that's why you are saying. So don't do this type of the thing. You have to check up, and if the other, you have to rule out every other possibility that she can suffer, then we can go for the somatization depression or the somatic autonomic dysfunction. Okay. ओके, इसको कुछ बताने की जरूरत ही नहीं है, खुद ही समझदार हूँ। Then question number 100, a 13-year-old male complained of the itching of the skin which intensify in the evenings. He has been ill for 1.5 months. On examination, if see, there is a rash with paired papules covered with the bloody crust on the abdomen hip. There is a folds between the fingers. So what we call that is the folds between the finger flexor surface of the hands. There are the traces of the line scratches. So what is that? That is the scabies. That is the scabies. Scabies, it is caused by sarcopsis. Then also remember, if it is the case of the scabies, in the scabies where the treatment also they can ask you, and the treatment, remember, you can give the permethrin creams. Treatment, you can go for the permethrin creams or ivermectin. And you will see that severe itching at the night. Severe itching at night. Interdigital area means between fingers or in the groin area. Okay, so the treatment, what you will do? Permethrin cream. Okay, so we have made the century, and I think if we will go further, the network can be disconnected. Okay, so that's why we have finished here today. Just ठीक है, इसका पूरा नाम sarcopsis scabi, but they will give you the sarcops, and treatment they can ask you permethrin 5% cream and ivermectin can be used. So what we see, the examination of the RAS element scrape will be examined, and that is of scabies. Okay, and all those questions we will discuss tomorrow. And tomorrow I think I don't have any things. Today was very hectic day, so I didn't take the long classes. But tomorrow I don't have so much things to do, so that's why we will do tomorrow. Try to do maximum tomorrow, and after that we will finish